Kia ora koutou katoa, good afternoon everybody. After a very quiet week on the COVID response front, and because everyone's currently talking about the weather, I'm particularly pleased to report today that the first 360 doses of the Pfizer vaccine were delivered to the Chatham Islands at 7:30 p.m. yesterday in somewhat stormy weather conditions. The Chatham Islands is home to one of New Zealand's most isolated communities. If COVID-19 was to make it there, the community could be severely compromised, placing significant pressure on the Canterbury DHB. They've identified the islands as a priority group, and people can expect to get their vaccinations on the Chatham Islands over the next few weeks. Around 560 residents on the Chatham and Pitt Islands will be eligible to get their first doses of the vaccine. They'll be storing them very carefully as they get their campaign underway over there. As of midnight last night, we have delivered 1,149,608 doses of the vaccine across New Zealand. That's an increase of more than 130,000 doses on last week. Within that, just over 705,000 New Zealanders have now received their first dose, and more than 444,000 have received their second dose, meaning they are fully vaccinated. Of those, 206,406 are in Group 3, or have had their first dose from Group 3, and 91,477 in Group 3 have had their second dose. Of the information going up on the Ministry of Health website right about now, we've added a bit of additional information to the dashboard this week. You'll see there's a bar chart indicating vaccinations by group, by week, and a table that shows cumulative vaccinations for each of our groups. Overall, we continue to track ahead of plan. It's about 8% ahead of plan, mindful that we have some tight delivery schedules that we're working for, and we're managing supply very closely. We've been clear for some time now that we could enter a period of tight supply relative to demand through June and early July. That's very much the position that we are in at the moment, as I outlined yesterday. But just to give you a little bit more detail on that, ahead of the large deliveries that we expect to receive from mid-July onwards, we're expecting 1 million doses to be delivered across July. We are finally calibrating the supply across our 20 district health boards. By the time our weekly delivery of Pfizer arrives next week, we'll have less than a day's worth of vaccine left in our freezers. That is a deliberate decision. We've taken the decision that we would rather have vaccines in people's arms than waiting in fridges. Transport management processes are now much more streamlined than they were in the beginning, meaning that we get underway dispatching vaccines to deliver to DHBs within a few hours. So vials can land by international air freight in the early hours of the morning and be on the road by mid-morning. Stock levels at each DHB are being monitored very closely, and we're making sure that the deliveries that we give them over this next few days is very closely aligned to their bookings, so that the stock is getting to the right places and to match that demand. In terms of Group 3, district health boards are continuing to contact everybody in Group 3 to let them know that they will be receiving an invitation by the end of July. By the 23rd of July, everybody who is enrolled with a GP should have received an invitation to book their vaccine. Group 3 vaccinations do continue to increase. In terms of the booking system, district health boards are in the final stages of transferring their existing booking data into the online system, Book My Vaccine. Book My Vaccine will be used to book appointments when our Group 4 rollout begins. So therefore it will be available to the wider public to see from the end of July, around the 28th of July. I understand some of the people in the room here saw a demonstration of that last Friday. It is a huge and complex system. Those going online today looking for it won't see it. It's only visible to those who are being invited at this point. But to successfully migrate all of the information into the system, the IT teams have been working well into the night, overnight in some cases. That work is unseen. Many people won't even know that it happens, but I do want to acknowledge those teams who are working incredibly hard and send a shout out to them to thank them for the work that they've been doing. We have had questions in the last few days on other vaccine candidates and the Janssen vaccine in particular. It is the next likely vaccine to be approved in New Zealand. The Medicines Assessment Advisory Committee met earlier this month to discuss their application, Janssen's application for their COVID-19 vaccine, and they're in the final stages of making a decision on whether to grant provisional approval for the Janssen vaccine to be used in New Zealand. And we should be able to provide a more comprehensive update on that next week. They're in the final stages of that decision-making process. So in closing, we started today by focusing on our vaccine numbers, but before I hand over to the Director-General for his update, I do want to acknowledge a couple of other significant things. The ongoing intensity required around our COVID-19 responses reflected in the 10,097 tests reported today. So a big thank you to those involved in testing across the country, and also a big thank you to those who have been coming forward to get tested. It's worth remembering that we have processed 2,288,000 tests so far during this pandemic. Having been the recipient of some of those tests, I do want to acknowledge particularly those who are being very frequently tested for COVID-19. I also want to acknowledge that we're about to hit another significant milestone in our managed isolation facilities. 150,000 New Zealanders will have passed through our managed isolation facilities within the next few days since the pandemic began, and we've seen very few incidents of COVID-19 passing out into the community. It has been an incredibly successful system, and that is the result of the hard work and dedication of those who are working at our border to make sure that where COVID-19 does land in New Zealand, it stays at the border and doesn't make it out into the community. So to all those frontline workers, wherever they are, whether they're at the border or in our MIQ, I think the entire country owes them a great big thank you for their work. I now hand over to the Director-General.
Thank you, Minister. Kia ora koutou katoa. So pleased to report today, as the Minister's mentioned, no community cases, and we have one new case of COVID-19 and a recent returnee in our managed isolation facility. All our other numbers will be reported through today's statement from the Ministry. With regards to the situation in Australia, members of the Ministry's Public Health team are continuing to closely monitor the situation there. Currently, more than 12 million Australians, close to half the population, are covered by lockdown-type restrictions there. And just to summarise what the situation is regarding quarantine-free travel and what is intended to happen over coming days, currently quarantine-free travel flights from all of Australia are paused until Sunday the 4th of July at 11:59 p.m. After that time, quarantine-free travel flights from Melbourne, Canberra, Adelaide and Hobart will resume unless there are developments in the interim that change the risk profile for any of those places. And all passengers travelling from those places must present evidence of a negative pre-departure test taken within 72 hours of boarding, and that test must be a PCR test. The quarantine-free travel pause remains in place for New South Wales, Queensland, Western Australia and Northern Territories until 11:59 p.m. Tuesday the 6th of July, and a review of the pause will occur on Monday the 5th of July, and officials are currently looking at options, as the Minister mentioned yesterday, to help return people home to New Zealand from pause-affected states or territories if the pause is extended there beyond 11:59 on Tuesday the 6th. A reminder, though, to anyone, wherever they are in Australia, that if you were at a location of interest, that at the time specified, you are not able to travel to New Zealand from anywhere in Australia for 14 days after that exposure event. Regarding pre-departure testing, travellers wanting to think about future travel back from Australia can look on the Unite Against COVID website to just get clarity around what is required, and the local health officials, wherever you are in Australia, will have information on where you can be tested. That testing is done privately, and the cost is generally between $120 and $180 per test. On border worker vaccinations, just a quick update on vaccination among that workforce, particularly those who don't work in managed isolation facilities. The latter group, of course, is required to be fully vaccinated. There are more than 200 businesses operating at a range of borders around the country, both airports and ports. This includes everyone from airport shop workers to truck drivers who are attending ports. You can appreciate also there is turnover of staff and that many of these people are only at these sites fleetingly as part of their work. The latest figures we have show that 83% of workers recorded as active in the border worker testing register have received their second dose of the vaccine, so they are considered fully vaccinated, while another 3% have received at least their first dose. The remaining 14% have either not yet been vaccinated, are exempt, or had not been able to be matched to their vaccination record. That's a small number. But only some of these workers, of course, currently fall under the current vaccine order that requires them to be vaccinated. However, as the Minister mentioned yesterday, there has been work on the next iteration of that border order, and it will be coming shortly. It will extend the mandatory requirement for vaccination to a much bigger group of people working at the border. The Ministry, right from the start, has worked closely with DHBs and our colleagues across government and in the private sector around that vaccine rollout to this group of workers. That's included providing information in multiple languages, holding face-to-face sessions with workers where they have had the opportunity to ask questions of health experts, and I myself have done some of those over Zoom. I'm confident that these workers have access to good information, and with between 150 and 200 vaccination sites open most days around the motu, they have had and continue to have good access to vaccination. Thank you, Minister.